Thank you for coming to our bite on vulval cancer and gynecological conditions and health. My name is Sunny. I'm the Sexual Health and Bloodborne Virus Program Coordinator for the Aboriginal Health Council WA, which I'm sure pretty much everyone knows. And I'll introduce Kath in just a minute. First, I'd just like to give an acknowledgement. Kaya and Wanju, hello and welcome. I would like to acknowledge the Whadjuk people of the Noongar Nation, whose lands which we're meeting on today. I wish to pay respects to elders past, present and emerging, and acknowledge the continual cultural and spiritual connection that Aboriginal people feel with their lands and waterways and communities. And I'd also like to extend this out to the people in the room today. Okay, so Kath and I met a few months ago. She is a survivor of vulval cancer and very passionate advocate for sharing information and knowledge with people and getting people talking about it, reducing shame and stigma on the topic. She's been actually all over the world doing this, and she has been nominated and won many awards due to this work. So hello and welcome.
Thank you very much for this opportunity. I feel honoured to be able to share my stories so that perhaps others can learn from. And I'm the voice of women in the community who have vulval conditions and gynecological conditions. So I think we need to hear more of the lived experiences. So I'd like to acknowledge the traditional Aboriginal owners of this land and pay respects to their elders past and present. In my speech, I may be showing photos of people who have passed, and yes, so I just thought I would let you know that. So I will start off with shame. 30 years ago, I had an abnormal pap smear. I was told to pop off and have my cervix lasered, and I knew nothing about that HPV was a risk factor to cervical cancer. But about 18 months later, I had a lump appear next to my clitoris, and I went to 2 GPs and a gynecologist, and they said it was normal and not to worry about it. But in the end, I asked for it to be removed, and it was cancer. And it wasn't until after I had my clitoris, vulva and lip implants that I turned to women's organisations, and I just felt totally isolated, and I felt betrayed, as a matter of fact, because it's like you don't fit in here, and you have breast cancer come in the door. And I was just totally amazed about the shame and the embarrassment. And I thought, well, am I supposed to be ashamed and embarrassed? But I couldn't live like that. So I met 2 other ladies that had the same operation, and I put an ad in the Woman's Day, and all these ladies wrote me these horrific, horrible stories. And I thought, but why is this such a stigma? Why is there so much shame? And so began my journey from there. So let's go to the next slide. So there's still a lot of shame around, and I just felt like my dignity was stolen, and I needed the courage to get it back. But this picture I loved when I found this picture, because I thought that's exactly how I felt, and I had to work out, why are these women laughing at me? But a lot of them probably had gynae issues as well. So I've gone on to establish an International Gynecological Awareness Day, which I pleased King Edward Hospital. I'm coming up to the 9th year. The Royal Australian New Zealand College of Obstetrics and Gynecology, they promoted it last year, and are promoting it again this year, which is fantastic. So, but if we can just go to the next slide. But I remember when this first happened, because I don't know how this Aboriginal Sharon from Campbelltown in New South Wales, she wrote to me and she said, my heart goes out to you. And she was the first one to acknowledge that what I was going through. So I'm really pleased to take this photo from years ago. And she's still a leader, an Aboriginal leader over East as well. So I noticed this article. I had an article with my former not-for-profit Gain Incorporated, and this picture came, and I thought, what is this all about? And it was in 1811, and I questioned ourselves, how far have we come since 1811 when it comes to gynecological health? But I noticed that there was these male gynecologists at the time, and I thought, but where are the females? Where are the voice of the medical women speaking out about the suffering in silence? So I've had to work very closely, and I had to very carefully to make sure that I didn't step out of line. But I'm really pleased with how far I've come, but there's still such a long way to go. So this is what King Edward Hospital. I've devised these knickers. To,
I don't think.
I can't see it. That's okay. Yes. So I thought, well, we have bras for breast cancer. Why not knickers for gynecology? So I do workshops around these knickers, and it gets women talk. It opens up the conversations. And my sister had this, my mother had that, and that's what we need, is more conversations. But not only that, we need to put a bit of fun into gynecology. It's such a serious topic, and too many women suffer in silence. So it's through the Gynae Awareness Day that I appeal to you. What is it that you can do to celebrate the Gynae Awareness Day, opposed to reproductive health? Because my daughter and granddaughter has polycystic ovaries and endometriosis. So by having the Gynae Awareness Day, we can raise all of these issues. So I, in 2002, I think I did a fever the vulva forum at the Royal Women's Hospital in Melbourne. And then when I came back, I did a presentation to the Pinjarra Aboriginal Women's Health Group. And while I was there, because I was always told by the white women, oh, don't say vulva, vagina, you might offend, the cultural people. And I thought, okay, so I just, just did it quietly. And I told this at my speech that I did the Viva Vulva Forum. And then when they went out and did their art, this picture came back and they put Viva la Vulva, and they said, oh, you can't do that, you can't do that. I thought, oh my God, I'm in huge trouble for saying vulva. But as it turns out, I ended up going to the Langford with Angela Ryder, invited me to speak out there. And their pride and place was this gorgeous piece of art with Viva la Vulva on it. So I need you to understand how much I've done and how much has to be done. But, I love sharing this message. So I'll go to the next one. So here's some of the Aboriginal work that I have done over the years. And because I couldn't say the gynecological words when I do my display, one of the Aboriginal elders in Geraldton, I think it was, she said, what's that on the table? And I said, that's a vulva. And she said, well, you should put the name Minnie on here so these young girls know about it. And I thought, oh my God, I've been told not to say those words. And here's an Aboriginal elder telling me I'm allowed to put those words on. So I just thought that was fantastic. But I did present for the blood-borne virus, I think back in 2012. So there's a lot of history with the work that I do. And anyhow, go on to the next one, thanks. Okay, so I went to Port Hedland, and this lady, Pam Heald, apparently she did a lot of work for the Aboriginal women for policy back in the day. Could have been 30, 40 years ago. She's still with us, but she's got dementia at the moment. But she invited me to come up there and speak. And I remember sitting there, and it was a very hot day, and my vulva was burning, and I thought, I've got to do this. So. But I know that a lot of people, when they listen to me, perhaps cringe and you sort of think, well, this is frightening people, but I have no intention of frightening people. It's all about empowerment. So, speaking of some of the Aboriginal women, I was born in Kalgoorlie, and I remember we used to surf when it really rained, like we used to surf in the gutters with the Aboriginal kids down the road. So, yeah, I've got a lot of fond memories and passion for Aboriginal health. So these are one of the cardboard knickers, and this lady, I think it was done up in Carnarvon, she designed her knickers off the bark of the tree, and I thought, oh my God, and I asked them to send it down to me. I had it for a long time, but I had to throw it out at the end because it was going off. But this is some of the workshop that I do. And you can just cover over the gynecological terminology, but you can just still hang it up, but you know what's underneath there, and it gets the community involved in the process. So people often call the vulva as a vagina, and it really irks me when they do that, because even some professional people still call it a vagina. And a female radiologist, I told her I had a radical vulvectomy, and she said, oh, it's a collective of all the vagina, as that is the norm. And I stated, it is the external is the vulva. And her response was, I don't wish to argue with you. And a woman's health physio, she said she will tell her daughter it's a vulva when she's older. And a health expert shared with her mother, she was treating a patient like myself with vulval cancer. The mother replied that the health expert's grandmother had vulval cancer, and the health expert had no idea. But I went to a hairdresser's the other day, and this old nurse, she told me that her sister died of vulval cancer, and she runs the bingo. And when the lady, she told me I could go and sit on that other table. So when I sat there, the lady I sat next to, out of the blue, her sister-in-law died of vulval cancer. And I thought, this is really, really crazy. We do have to work on the shame and the embarrassment and come from a new, different perspective. Sorry, I'm talking fast here. I'll just slow down. Yes, so I did a presentation in the Melbourne Council many years ago. And Iris Whitlock, she organised it to happen. And the Aboriginal artist Julianne Wade, she designed the drawing, and then after I presented, we all did the dot points, and I thought, oh, this is so magnificent. But it was during COVID, and then it was put to the back of the cupboard, and I kept asking, where is it, where is it? And they said, oh, they have to wait. So I waited for a few years. I took it back to my house, and it was still sitting there. I thought, what am I going to do with this piece of beautiful art? So I've now given it to King Edward Hospital, and we're going to be launching it on the International Bone Awareness Day on the 10th of September. And I just can't wait to see this in the private place in King Edward Hospital, where I feel it belongs. So I'm really proud about that. That was it then, I think.
There you go.
Yeah.
Okay.
So I just wondered if there's any questions or comments.
Bit shy. Veronica, did you have one?
Oh, can you hear me?
Yes.
Yeah. Oh, thank you so much, Kath. That was great. And I guess if you go back to when you first were diagnosed, what was it that alerted you to something not being right?
Well, there was a lump in the vulva, and when I was having sex, it was becoming more and more uncomfortable. And so I asked for it to be removed in the end. And so that's when I found out I had cancer. But had I not pursued it, I probably would not be here today. And I know women that aren't here today. And I also have another concern about women with lichen sclerosis. Do you know about lichen sclerosis, Veronica?
Yeah, I do actually. I lived in Kalgoorlie for 20 years, and
really?
one of my friend's daughter has actually got that. And she's had quite a large amount of her vulva removed.
Yeah.
Young mum.
Yeah, I know her myself. I'm actually going to Kalgoorlie to do a presentation next month in Kalgoorlie, and I think that she'll be there as well. But we also need to mention about the 23-year-old girl that died recently of vulval cancer, and her mother and her family is absolutely devastated. But it's like, yes, but we don't talk about it. And I think this, it's the essence of who we are, and really amazed at how it still is a stigma out there. And I'd like to hear from you how you think we can break that stigma.
I think actually as well, I remember you mentioning that. So lichen sclerosis is a condition. I think, it's a skin condition essentially. And so the tissue in the vulva is thinner and more prone to irritation and tears during sex and that sort of thing. And so people, I think, are prescribed a steroid cream, but most people don't know that that people with that condition are more likely to have vulval cancer in the future. And so if someone does have a lump, especially if they have that condition, then it's something to take very seriously, which I think was with the young 23-year-old. She had that condition for many years and had a lump, and it wasn't taken seriously, and people just didn't know.
I think she was about 12 when she started to have the lichen sclerosis, and I know another young girl. She had lichen sclerosis, but her vulva was bleeding, but they had to question the father whether he'd been sexually abusing the daughter, when in actual fact it was lichen sclerosis. So we need to try and somehow get men to understand that, you know, these I think I'm going off track when we start talking about the men, because I think we need to just focus on the vulva and women's issues. But it's just very sad that it's you know, it's like that out in the world. But I am a member, I am an associate, what is it, investigative associate for the vulval cancer in Queensland. But the statistics, for those that need to know, it's 433 were diagnosed in 2023 and 123 died. And at 74% diagnosed of vulval cancer survive after diagnosis. But unless women come forward and be brave enough to say that they have a vulval condition, you know, sometimes it can be too late. And you might look at the numbers and think, oh, that's not many, it doesn't really matter. Well, it really does, because if 1 in 80 women have got lichen sclerosis, and sometimes doctors are treating it as thrush, and sometimes the progress, you know, it can progress into cancer, but I'm also concerned about the precancerous conditions, because, you know, you might have lichen sclerosis and it's a precancer, and then sometimes they might remove it. It's not on the statistics. So I'd like to question the statistics while I'm in this investigative stage to say, well, you know, you remove a tiny weeny bit from a woman's vulva and nobody in the world talks about it. Imagine how that woman feels. Imagine her sex life. Imagine her husband as well, a partner. So, you know, there's so much more work that needs to be done in this area.
I think as well, I don't know, I know that when I've been out to work, we talk to people about checking their breasts, self-examining, you know, once a month, and we talk to people about making sure they're up to date with their cervical screening. But I don't remember ever learning or speaking to people about examining their vulva. And then how will you know there's a lump if we're not checking? So I think that as part of the talks we do when we're chatting with women, that it's important that they know what their vulva looks like and feels like, and to report if there's any, you know, anything they're concerned about or any changes. And also, I used to do cervical screening where I was, and I didn't know about lichen sclerosis. So I wonder how many, you know, of us out in the field could know more about that condition. Think better.
But I feel I've got a very powerful message, because the health consumer voice and women, people willing to speak out alongside professionals, well, that to me is the whole box and dice, so to speak. So, but I just don't know how we're going for time, but I've devised, I don't think we can go in close enough for this, can we? I've devised, oh, okay, didn't do that. It's one of those chatter boxes we used to have as when we were children, and a lot of women say, oh yes, we used to have those. And so the outside has got the gynecological anatomy, and then on the inside it's got the gynecological conditions, and then one sentence explaining what the condition is, and then it's got the whole gynecological anatomy there, and it's plain and simple, speaking the language of the women on the ground level. And we can help save lives by doing this. But also on the Gynae Awareness Day, I'm suggesting that you might have some biscuits, some love heart biscuits. You turn them upside down and you ice them like the knickers. And it gets people talking and laughing, and that's what we need to do, and sharing stories. So there's a lot here. Oh, here, just show these knickers as well.
So I don't know if everyone remembers too, but I know years ago when we used to run Women's Health Days and talk about pap smears, I was called at the time. WA cervical cancer prevention program used to have the bunting and, you know, the underpants that people could colour and decorate, which were very popular when we had community gatherings, and it turns out they got the idea from here, which is pretty cool, I thought.
Yeah, so that's just the knickers, and you just decorate it with bling and then lift it up, and then underneath there it's got all the gynecological bits. So it's one way of accepting and sharing the story. So Yeah, I'm really excited about the progress that's happening, but I need your support and to see how we can progress further with this.
I think too, something I've learned since chatting with Kath, which you'll notice if you look at health promotion materials going forward, is that many of the things that outline female anatomy don't actually involve the vulva. So it just has the internal organs, but the external ones aren't drawn on there. So it's just funny how it's just not included in things when actually it could be life-saving for people to know about it and chat about it. Does anyone else have questions? Oh, Charlie's got a hand up. Did you want to say something, Charlie?
Sorry, I was just having a bit of trouble with my computer, but I just wrote it in the chat instead, just saying how much I love the humour and the playfulness to just erase the discomfort from these sorts of conversations. I think it works every time, and people from all walks of life and all nationalities love to have a laugh about stuff. So I think it's amazing. I love it.
Thank you, Charlie.
Yeah.
All right. Does anyone else have any questions or any comments or anything? Hopefully it's given people some food for thought about how we can about chatting more in community and including it in talks that we have with people in consults or health promotion events and things like that. I think that apparently, I mean, we all know that there's not a lot of statistics on incidences in Aboriginal and Torres Strait Islanders because their status is not always recorded, so it's hard to get statistics on this, but the data indicates that Aboriginal and Torres Strait Islander women are more likely to be diagnosed and die from gynecological cancers than non-Indigenous women. And yeah, and as we know, people in the field, it's not uncommon to be diagnosed very late into the piece, and it's just far less likely that they can do anything to help when it's when it's spread.
Well, just looking at my brooch, I don't know if you can show them
Yeah.
what that is on my book. This is called If Only I Knew. It's hard to see, but I'd love every woman in Australia to wear this brooch. But it's not everybody's cup of tea to be so open about that. But, a lot of the younger generation, they have a good laugh about it. And this is my book. It's called If Only I Knew. So I've tried to funk it up a bit. And there's a diagram of the ovaries and the uterus and the diagrams there. But, it's just done it in a modern sort of way. But I don't have funding for this, and I need to try and find a way. But I had Roger Cook and Amber Jade Standerson speak about my work in Parliament as well. So, it's all well and good for what I've done, pat me on the back and give me another award. But I'm looking to you for some action. What is it you can do from an Aboriginal perspective, how you can be more open about this to help get rid of some of the shame. So.
And here's some more, I know they love artwork out in communities, so the lighting's not that great. Sorry, everyone.
That was material I brought from Spotlight, so I just thought I would try and sort of make it look how we can, how we can funk up Aboriginal work in a sensitive and fun way.
Questions, ideas, anyone? Kelly.
Hi there. I'm just wondering where we can access some of the resources or are there any accessible resources in regards to yarning or part of the Aboriginal Health team and the wheat belt?
Yeah, great question. These sorts of things here are these things that we can share out with the regions if they'd like to do some activities with the women.
Yeah, sure.
Yeah.
But I've got them on my website, which is kathmazzella.com. You could just go through there and I'll be able to answer any questions. Oh, did we talk about this? No. Here's another thing. I've been knitting these at home. They're knickers that because again it gets the community involved and the talking, and it's all about the visuals. And I think we need to have the visuals to be able to progress further. We might do another brochure, but I just think we just need a different way. That's all.
Yeah, I think it's coming up for gynecological cancer awareness and cervical cancer awareness and that sort of thing coming out. Women's health. Yeah,
Women's Health Week's coming up soon. But you see, I think that gynecological health is it's a Cinderella of reproductive health, because reproductive health to me is about having babies and contraception and abortion. But gynecology is, you know, a completely different thing. And I think we need to understand the body of the gynecology before we get a cancer diagnosis or any sort of diagnosis. So
Yeah, I think it's really important that people know about their bodies and their anatomy and what's normal for them, so that they know when something's not normal,
Yeah.
that they should bring that to the attention of their doctor.
and they're comfortable enough to talk about it.
Veronica, thank you. I see you've shared Kath's website in the
Yeah.
chat. So if anyone would like to go and have a look at Kath and her resources on there.
Thank you, Veronica.
That's all right. I was thinking too, there's a lot of people online that are health professionals who see women. And I think perhaps we need to think about the sorts of questions that we're going to ask women when it comes to their women's health, and sort of normalizing those things that we say, like, you know, does it hurt when you have sex? Is there any abnormal bleeding, but maybe it's not coming from a period? Yeah, that, like, sort of thinking about those questions that might prompt women to think that maybe they need to double check something. You know, can you feel anything abnormal down there? Is there any lumps and bumps that just don't feel right?
Yeah.
Yeah.
I have got a package online where it says what words to use. You know, a lot of women go and say, "Oh yes, I've got a pain down there." You know, but you've got to be a bit more descriptive than just saying a pain. You know, it's for the doctors to understand.
I think as well, I just lost my train of thought. Dementia. Yeah, but it's good. I think working in sexual health, when you get people that come in with a lot of symptoms down there, then it's common to think they could be related to sexually transmitted infections, when sometimes it could be, you know, some of the symptoms seem similar to ones that could be vulval cancer or that sort of thing. So yeah, that's good to know. And I think if we don't know to tell people to get a check to look for a lump in the first place, then you know, that's just something we can work on. I know myself.
I believe that there is next year there's going to be 5 different states that are dealing with vulval cancer research. So, you know, it's really exciting after 30 years to sort of think, whoa, you know, things are really changing, but we need to change it from the ground level as well.
Yeah. I remember too that 23-year-old who passed. I looked up some information about her, and they had to do a GoFundMe to get money to cover costs, because apparently vulval cancer is not common enough to be covered by Medicare or some such thing. I couldn't believe it when I heard that. So, which is terrible to live in Australia and have to face that. In any case, if there are no other questions or suggestions or anything, then I think that's a wrap. Thank you everyone for taking the time out of your very busy day to come and have a listen and learn more about this. And if you need to chat more or want any information, feel free to reach out to myself or to Kath, and we'd be happy to help.
And viva la vulva to you all.
Yes.
Thanks,
everyone.
Kath. Thanks, Sunny.
Thank you.